Hundreds of years of medical experimentation and medical apartheid has cultivated not only hesitancy but distrust for the medical community among African Americans when taking the COVID vaccine. In 1932, the United States Public Health Service conducted the medical study of syphilis in black men, known as the Tuskegee experiment. These men were never properly informed of the actual intent of the program. The fact that the medical community deceived these men and their families about the study, which lasted for 40 years, where 128 men died, is just one of many reasons the African American community frequently questions the motives and sincerity of the medical community. I spoke with Dr. Tanya McDonald, who is a pediatrician and who received her medical degree from Harvard Medical School. I also spoke with the Honorable Judge Mark Morrell, who is a judiciary judge for the city of Dallas and is also a pastor and a leader in the black community.
The fact that we were excluded from a lot of those studies in the past in general, or when we were involved in ways that were completely disrespectful of our rights to informed consent and participation. As you, I'm sure, know, everybody keeps referring to the Tuskegee Project with the studies on syphilis and the failure to treat, even though they knew penicillin was the appropriate treatment. Those studies, that history colors everything forward.
In the story of Henrietta Lacks, doctors from Johns Hopkins Hospital violated her rights, furthering not only hesitancy but distrust between the African American and the medical communities.
When you look at Henrietta Lacks, her vaginal tissue was taken in 1951. She didn't even have a right, like she wasn't allowed to exercise her right to vote. I mean, there are a lot of things that have changed, and I think part of what we're going to have to do is help people understand that while that is our history, that is not our reality anymore, that there are concerted efforts in studies, especially for medicines, illnesses that are going to highly impact minorities, to recruit minority patients.
Whether enslaved in the past or free like African Americans are today, throughout history, blacks have had minimal access to quality and affordable health care in the United States.
From the very beginning, we've always not had the best medical access from the beginning in this country. Our history goes even deeper than Tuskegee. I mean, the truth is we were denied access to medical help.
But perhaps the solution to this problem lies in the past instead of in the present.
I think medicine has to get back to that field of small town doctor. When you have a doctor that's more in tune with what's going on with you, I think we start seeing that turnaround. So it really is the medical practice moving from the big business model to the small town doctor model, to me, which is, we know now, the private practice model, and really treating your patients like you would want to treat your own mother. Because if I was a doctor and my mom was sick, I'm gonna make sure my mama good. Do that for me too, and do that for all your patients.
For NT Daily News, I'm Joshua Carter.